Hello and welcome to NETEC's webinar series, Lab Samples and Suspect Cases, How to Handle, Package, and Ship Specimens from High-Risk Patients. We are going to cover the classification of a PUI, or person under investigation, those specimens and how that affects their shipping, suspect category A versus true category A packaging, couriers and carriers, and then shipping plan considerations. And I'm very grateful today to be joined by Robert Nickla and Karen Stiles, and we'll get to them in just a minute. Our target audience is, of course, laboratorians, but also anybody doing hospital or healthcare preparedness, safety officers, staff who might be drawing specimens from high-risk patients, and certainly people who might be doing teaching and training. If you're not familiar with NETEC, our mission is to set and advance the gold standard for special pathogen preparedness and response across healthcare delivery systems with the goal of driving best practices, closing knowledge gaps, and developing innovative resources, of which we think this is one. And NETEC has three core functions. We consult with healthcare facilities and help them prepare readiness, and that can be done through self-assessments, the collection of metrics about readiness assessment tools. We provide on-site assessment and then remote guidance. We also have an emergency on-call mobilization. We have education, of course, for things like today. When possible, we do love to deliver in-person courses. We do online trainings. We have an online repository of tools and resources. And we also have exercise templates for those of you who might be emergency managers or those folks that are responsible for drills and exercises that are HC compliant. And then we also have a research network. So we are building a central IRB and developing policies and procedures that will help facilitate research and the early deployment of things when we do have these special occasions of special pathogens, including a specimen biorepository. All right, so today I'm going to actually kick us off with this idea of what is a person under investigation, or PUI. And I think for most of us, this term, at least in most regular healthcare sectors, really came to the forefront during the Ebola outbreak in 2014, although it's a term that's used in other circles much more often of when they're doing contact tracing and things like that for all sorts of other epidemiological needs. But it's typically defined as a person who's being monitored or investigated or suspected of being potentially infected with one of these high consequence pathogens or anything else that someone might be tracking. These high-risk pathogens or high-consequence pathogens, special pathogens, these terms are all used sort of loosely and interchangeably, but we're going to get to a part today where we really talk about how some of these pathogens are actually defined in a much more specific sense when we're talking about their specimens, their cultures, or other things that might need to be packaged and shipped. So I think it's important for folks to know that the viral hemorrhagic fevers, of course, we're all concerned about the current Ebola outbreak in Uganda, and we're going to talk about that more in just a second. But all of our viral hemorrhagic fevers that infect humans come from these four families. And it's really very fortunate to us that they are all lipid-enveloped RNA viruses. And I'll talk about why that we're grateful for that in just a second. But we have the arenaviridase, that's Lassa. Most of those things come from rodents. We have the filoviridae, that's Lassa and Marburg. We have and Ebola. And then we have, sorry, my slide's a little awkward there. And then the Flaviviridae, which is yellow fever and dengue. Mostly these families come from ticks and mosquitoes. And then the Bunyaviridae, which is, it's not quite exactly the same family because that's a huge group of viruses there. But the most prominent one we see there is Crimean Congo hemorrhagic fever. So the good things about those viral hemorrhagic fevers is that their lipid envelope makes these viruses very susceptible to many cleaning agents. So we use the example frequently that, the old Dawn dishwashing detergent or anything where you see that it dissolves those lipid membranes. So disinfection of these is not terribly difficult on surfaces, but their treatment is actually quite a challenge because for many of these things, we have only supportive care. There may be some antivirals you can try. And of course, we do have some vaccines in trial. But as many of you have probably heard, The Ebola vaccine that has been used in previous Ebola outbreaks is actually not effective against the Sudan, the current outbreak. The symptoms for viral hemorrhagic fevers tend to be both common and nondescript. So things like fever, headache, nausea, vomiting, diarrhea, muscle and joint pain, fatigue are probably what your emergency departments are full of this time of year. So it can be very difficult to look for a particular symptom that you think is indicative. The diagnostics for these tests, there are many rapid tests available depending on the pathogen, but many actually require specimens to be sent to the CDC for confirmatory testing. And people need to know that and figure out how that's going to work for their facility. The prognosis for these illnesses is also highly variable, with some of them being very mild in their disease course and others, of course, leading to organ failure and death. And not all viral hemorrhagic fevers are transmissible person to person. So I think it's an important thing to keep in mind that we get concerned because their infectious dose tends to be small, but not all of these things can be spread person to person. We should be screening all patients. Yes, we want to be able to identify folks early, and this is where this idea of a PUI comes from. Identifying someone means that even though these symptoms can be vague and common, we need to ask about travel history and exposure risk. And right now, the CDC is being pretty conservative about testing folks. Travel to Uganda is the current screening priority. But beyond that, really thinking about what activities somebody might have been involved with. And we like the idea of using travel history as a door opening for all sorts of other questions. So, you may have people that didn't travel to Uganda, but they had some other exposure risk that might put them at risk of a different pathogen. So even if you're not looking for Ebola, were they on a cruise ship? Did they eat raw oysters? Do they have a pet ferret? Or any of the other things that can really help you discern what might be going on with this patient. It's important to isolate our next I in the 3 I's. So protecting yourself and others by putting people in a private room. Not every person or PUI is going to require all of the ornate PPE ensembles, and really thinking about what that risk assessment looks like and what you will be able to do for that patient, what you can do and what you will be tasked to do safely. And then informing, of course, knowing who your stakeholders are, knowing who your best resources are, and also early involvement of public health laboratory, and the CDC. If you have a person that you believe qualifies as a person under investigation for a special pathogen. So, as we said, the Uganda outbreak is really isolated to a few regions within Uganda. And I know personally, I am a person who had a public education in the south of the United States, and so my knowledge, unfortunately, of geography is frequently limited. So I love to refer to maps for what kind of area we're talking about. So on the left there, you'll see where these regions of Uganda are, and then on the right, you do see where Uganda is and how big it is compared to the United States. So just as you might say, if somebody were in Uganda but in a different part, that they're not at risk. Certainly, you can think that somebody who's in Texas may not have the same risk as somebody who is thousands of miles away. And those are the kinds of distances we're talking about with some of these exposures. So the initial screening questions, these are the questions that the CDC is going to want to know from you, from your providers, about whether this person has had what we would consider an epidemiological risk. Did they have any of these things that were positive? Were you in the area where there's an outbreak occurring? We've got that map. Did you have contact with anybody? Were you around anyone who was sick or who died? Do you have any exposure to blood or body fluids? Do you visit or work in a health clinic or hospital? And did you touch a dead body or attend a funeral? So those really tells you that when we think about what a PUI is, we've already gone through the people who screen positive at the very front about travel, and then the people who, yes, they traveled. Not only did they traveled to Uganda, and then a smaller list of people who would have an answer to one of these questions before we would call somebody a PUI. And then one of the other things we really want to drive home today, even though it's not strictly about category A packaging, is thinking about, as you engage with laboratorians, or if you are a laboratorian, as you engage with your other team providing care, what can you offer? What testing can you offer safely? What testing might help you discern what's going on with this patient? Do you have, for instance, point of care testing that you might be able to dedicate to that space until you know whether someone's positive or not? Can you conduct a lab risk assessment to decide and determine for your clinical team what tests you might be able to offer in the ongoing care of a patient who might be a PUI? All right. So just to wrap up, the most important pieces about what is a person under investigation. You need to be able to promptly identify these folks. We don't want you to have a situation where somebody's in your facility, on day 3 or day 4, before somebody says, we need to think about that. Many of us in healthcare have come back to work after a couple of days off, only to find that somebody's in isolation, and you think, why wasn't this in place when I was here and taking care of them? So we want to really make sure that for these high-risk pathogens, they're identified early, that we use appropriate isolation, that we've informed and enlisted the support of our infection prevention and control people, our public health folks, and we're initiating testing if we need to. And of course, all of these folks, EMTALA still applies. So we don't want to delay care. We want to make sure that we're treating these folks appropriately and doing what we can for them while they're in our facility. All right. Well, I'm excited to turn it over to some great folks and experts in laboratory science. So I am going to turn this presentation over to Robert Nickla and Karen Stiles. All right, Rob, I'm turning it over to you.
All right. Thank you, Jill. And of course, thank you, NETEC, for inviting me to speak today and for this really great topic. Very excited to get granular on the subjects we're going to talk about today. So my background is I've worked in public health since 2004. I worked at the Arizona State Public Health Lab and the Oregon State Public Health Lab for almost 20 years combined as a microbiologist, bioterrorism, chemical terrorism training coordinator, biosafety officer, select agent RO. And then I took position at APHL 2 months ago, the Association of Public Health Laboratories, to manage the fellowship program. So I'm very excited about those opportunities, but also very excited to come back here and have this discussion about something that's pretty near and dear to me, and that is shipping infectious specimens. Very excited to get granular on some of these key concepts. Jill did a great job setting the stage for us to have an understanding of what is a PUI. So now we're going to kind of translate that over to these PUI patients to the PUI specimens and what considerations we need for packaging and how that relates to category A. So, all right. So for PUI and category A specimens, I think one of the most important things to think about right away is that PUI is more of an epidemiology or infection prevention term. This is not a recognized term in the world of shipping classification, but we're going to talk today about how we do relate that over to shipping classification. Specimens that are coming out of a PUI person should have the same kind of level of concern and categorization that we think about for the PUI patients themselves. So really what we're saying is that the specimens that are coming out of these PUI patients should be looked at as the same kind of high risk and allowing us to really think about how and why they should be classified as category A. So often these PUI patients are higher risk for a number of reasons, but primarily because they're believed to be harboring an infection with a higher risk or higher consequence pathogen. So when we think about that in terms of specimens, these same specimens that are linked to those same diseases are on a set list already of higher consequence, higher risk pathogens, known as the category A list, which we'll talk about. So typically PUI specimens are usually classified as category A. There's obviously a couple leeways and some it depends situations, but typically they're category A. So what we're really going to get into today is talking about the difference between full category A infectious specimens or substances and suspected category A for shipping purposes. And we're really trying to hone in on this today because we're aware that this can definitely cause some significant challenges to frontline facilities to have this understanding, have category A shipping materials on hand, being able to maintain a current number of adequately trained staffs that are able to ship category A materials, as well as having these kind of planned considerations in place for if a courier has already been identified, if there's already kind of coordination in place with local public health or state public health when these cases and events pop up. So these are the concepts that we're really going to dig into today. So when we think about this classification, some of the key points for us, Jill had mentioned a moment ago, we have to think about, is the specimen in a culture form, or is it still in this primary patient specimen form, like whole blood or stool? Because that's definitely going to make a difference between if something is on the category A list or not. And then likewise, what level of testing has been done on the specimen already? And this can definitely help make a decision for whether or not you're allowed to classify the specimen as suspected or not. So for example, if something has already had identification level or confirmatory level testing, you really can't get away with using the term suspected category because you really already have the level of information already that this is the organism that you think it is. So suspected category kind of really more falls in the category of very, very initial testing. You're sending something off for an initial diagnostic test. You don't have confirmatory testing yet. This is really what we're talking about when we think about suspected category A. And then the other information that's most relevant to us, in addition to just what testing has been performed, is what do you know about the patient, right? So everything that Jill just mentioned about the travel history, but also just, do the patients have symptoms that are compatible with the suspected disease, right? Like all these things help kind of paint the picture, not only for the patient, but also for the specimen. So we don't have time to get into all the details of category A and infectious substances, but we wanted to at least get a foundation understanding for this. So hazard class 6 material is broken up into 6.1 and 6.2. 6.1 is toxic or poisonous material. In 6.2, the division 6.2, this is infectious substances or infectious material. So 6.2 material is defined as infectious material that is hazardous material that is known or reasonably expected to contain a pathogen for shipping purposes. And when we're talking about pathogens, these are defined in shipping purposes as a microorganism or other biological agent, including prions, that can cause disease in humans and animals when exposure to it occurs. And then to kind of walk us through this a little bit more, when we think about these pathogens, we classify pathogens into risk groups, right? So risk group 1 all the way to risk group 4, with risk group 4 being the most dangerous or the highest risk, risk group 1 being least dangerous or less dangerous. So this is important because it really helps us understand the connection between organism risk groups and how certain organisms should get classified as category A, category B, or possibly exempt. It's really difficult or near impossible to classify something that's considered infectious as exempt. They're typically falling into the category B or category A criteria. So when we want to have a quick summary of what do these different risk groups look like, this should be a good overview of that for us. So when we think about risk group 1 organisms, these are organisms or agents that should not be associated with disease in otherwise healthy humans or animals when exposure to them occurs. So you can kind of think about this as high school science organisms, right? They really should not be causing disease when exposure occurs. Risk group 2 organisms, these are things that we very, very commonly see. These are organisms that are associated with human disease, but rarely do they cause a life-threatening or very, very serious disease. And oftentimes there's antibiotics available, there's vaccines available. And these are diseases that are, sometimes maybe are causing diarrhea, but they're not necessarily going to kill you, right? So we think about things like enteric diseases like salmonella, norovirus, other things like pertussis and seasonal influenza. And then we think about risk group 3 organisms. This is when we do start to think about, okay, these organisms could actually have the potential to cause more of a serious or life-threatening disease. Oftentimes we don't have antibiotics or vaccines available always for them, sometimes, but not always. So we think about organisms like tuberculosis, the various brucellas, highly pathogenic avian influenzas. And then when we think about risk group 4 organisms, these are definitely very dangerous organisms where there's a higher likelihood that they're going to actually cause lethal disease when exposure to them occurs. And oftentimes there's little or no options, so little or no antibiotics or vaccines available for them. So what comes to mind for that is typically Ebola. So I added something on this slide here that this kind of helps, I think, understand where we kind of draw the line between category A and category B specimens. This is not a hard and fast line. It's kind of a suggested line here, but typically this is kind of where we see the division between category A and category B. And then just to talk a little bit about biosafety, this is also really how we think about practices in the laboratory, because we work with risk group 2 organisms in BSL2 or biosafety level 2 settings, right? So we have BSL-2 facilities that provide us protection and containment while we're doing BSL-2 practices in that setting. So we really, even though they're not an exact one-to-one ratio, they are definitely kind of mirroring each other, where we work with risk group 3 organisms safely in a BSL-3 laboratory and risk group 2 in BSL-2 settings. So when we think about this division 6.2 material, essentially we're classifying these into 2 main groups, category B material and category A material. The vast majority of specimens that are being shipped for infectious disease diagnostic testing are category B. When we think about category A, there's actually 2 subtypes of category A. There are organisms that are affecting humans and or animals, which is falling in the 2814. And then there's organisms which are affecting animals only, which are classified in the UN 2900. This is important because you definitely need to have an understanding of the patients that you're dealing with, right? So is there a possibility that you're only working with an animal pathogen? If so, you may have to have considerations for the UN 2900 infectious substances that are affecting animals. But primarily what we're talking about today is the UN 2814, which are diseases that can infect humans and or animals. And then obviously, category A organisms are posing a higher degree of risk than category B organisms. So when we're thinking about the definition of these category A organisms, these are organisms that are able to cause permanent disability or life-threatening disease to otherwise healthy humans or animals when exposure to them occurs. When we think about exposure, this is when an infectious substance is released outside of its protective packaging or containment, resulting in physical contact with humans or animals. So this is an important concept that's kind of just built in to the definition of category A pathogens for shipping purposes. And then one thing that we think is very important to note is that when you're looking at a category B box, it definitely says category B biological substance on the label because that's required. There's no biohazard symbol, but it does clearly say category B. Unfortunately, when we look at category A boxes, they do not say category A on the outside of the box, which might seem a little unusual, but we do see that the image that's on the right-hand side here, the marking for the category A infectious substances and the class 6 material, we see the prominent biohazard symbol, but it does not say category A anywhere on the box. So it's really important that people kind of have that understanding of what some of these packaging materials look like. So we are going to get into now the importance of the word culture or cultures only after the pathogen name. So when we look at this category A list, which will be available to you in these slides when we share them, some of the organisms have the word culture or cultures only after the pathogen name. And when we see that, we can say that, okay, only those pathogens that are in culture form have to be handled and treated like they're category A for shipping purposes. When we don't see that, like we do for Ebola, where it just says Ebola virus, that means Ebola virus in any shape or form, whether it's in culture form, which would be a very, very rare occurrence for somebody to be culturing Ebola virus, versus Ebola virus as just a whole tube of blood specimen. Either one of those, culture of Ebola or just raw patient primary specimen of Ebola, still need to be classified as category A because of the consequences that organism poses compared to some of the others we'll see on the next slide here. So getting into this a little bit more detail, I'll give you the visual about this. This is just a portion of the complete category A list. And if we look at the ones on top, Bacillus anthracis, the organism that causes anthrax, a couple of brucellas there that cause brucellosis, they all say cultures only after the name. So that means if I had a whole tube of blood or just raw stool of a patient that's suspected to be anthrax, you can classify that as category B because you're not shipping a culture. You're still shipping a primary patient specimen. So then we look down below and we see Ebola virus. It does not say cultures only after. So that means Ebola virus in any shape or form, whole blood or culture, needs to be classified as category A infectious substances. And there's a lot of factors that go into what gets on this list at all versus what gets the cultures only after it. And thankfully, this list really doesn't change too much from DOT or the Department of Transportation. So here is a bigger snapshot of what this category A list looks like. This list is actually called the examples of category A or the indicative list of category A, meaning that it's still subject to a little bit of interpretation from the shipper when classification arises. So we try to highlight a couple here that would be maybe more common or more relevant for you to think about. So I highlighted some of the ones in bold where you may actually encounter some of these cultures, but you have to think about what facility capabilities do you have? Are you even doing culture work to have this be a consideration for you? Because if we're talking about frontline facilities, oftentimes there isn't culture work happening. It's just a specimen collection and then specimens are sent off somewhere else for the workup. So having that in mind up front is very, very critical to even know what is the specimen type that you're dealing with. Are you dealing with cultures or just primary patient specimens? So we've obviously highlighted Ebola in the bottom left because we're going to kind of focus on that one today. Highlighted monkeypox just because it was a really good, relevant example of where we saw a really needed guidance from CDC and DOT about this one, which I'll kind of touch on more on the next slide. So what we were just looking at was the DOT category A list. And what we're looking at now is the Health and Human Services, or the CDC and USDA, a select agent list. They are very, very similar, but they are not identical. One thing of note here is that the select agent list does not say cultures only after any of these organism names. It does not have that consideration whatsoever. The thing that kind of relates this back to monkeypox is the select agent list does have an actual list of organism exemptions or exempt strain reasons that to say, okay, well, if I'm working with a certain strain of monkeypox, I don't need to consider the select agent because it's an exempt strain. So that's why we really needed that guidance early on from CDC and DOT to kind of help us kind of clarify, should these recent monkeypox specimens be classified as category A or category B? Because when we see monkeypox appearing on the category A list, it implies that it really should be treated as category A. So having that guidance early on from CDC to say, well, when we're talking about only the West African clade versus the Congo Basin clade, we are allowed to classify these as category B for diagnostic shipping purposes. And the importance of this was that not only are we pointing out that these lists are very, very similar, but have some slight differences, including some organisms that are appearing on one list and not the other. The other reason that we really want to mention this is because this is where we really see the suspected category A term have a lot of applicability. So what's right off the bat important to note is that all confirmed select agents have to be packaged and shipped as category A, but a frontline facility shouldn't have a confirmed select agent that they're shipping. Anything that you're sending out, should just be for that diagnostic confirmatory testing. So it's extremely unlikely that a frontline facility would actually have a confirmed select agent. If you did, you have to go through the whole CDC APHIS Form 2 to transfer a select agent between approved facilities. So the reason why this is so important for us for shipping purposes and using that term suspected category A is because it really comes down to not what the select agent program thinks, but how do our couriers and carriers deal with this? So several years ago, due to several kind of recent events that happened at the time, FedEx said, you know what, we don't want to assume this risk and liability to our company. So therefore, we're not going to accept confirmed select agents anymore. And we don't want to accept any risk group 4 organisms such as Ebola virus. So the way that we kind of work around that is saying, well, we're not actually shipping confirmed Ebola. We're shipping something that we suspect is Ebola and utilizing this term suspected category A. So we'll kind of see kind of two differences with suspected category as it relates to packaging and as it relates to the shipper's professional judgment to kind of make that determination. So again, PY specimens are not considered confirmed yet. They're still just being sent for diagnostic testing. So when we say suspected category A, it actually kind of allows us to utilize a carrier like FedEx for these kind of very, very unique situations. All right. So now when we're thinking about the packaging itself, when it comes down to the proper shipping name for category A substances, we think about the one that's across the top or the first bullet there. And that's the entire thing has to be there. The UN 2814 infectious substance, affecting humans, and then putting the technical name of the organism in parentheses there. So this appears not on the actual outside of the box, but on the paperwork that accompanies the box, which is accessible on the outside of the box, right? Like in a clear pouch on the top. So this is what's known as shipping papers, or if it's going by air, a dangerous goods shipper's declaration. So what we will see on the outside of the box is the label that's on the right-hand side of the screen there, the class 6 label, as well as a label that says just UN 2814 infectious substance affecting humans. The technical name is on the paperwork that's going with it. So when it comes to the suspected category A, we actually have these 3 options that are listed here. You could list the technical name of the organism right there, but then you're not really saying this is suspected. If you're saying the technical name of the organism, you're implying that is this organism and this is classified as a normal category A. The second one and the third one, this is where we see the suspected. So you have the ability to actually write in the term suspected Bacillus anthracis, suspected Ebola virus, suspected Lassa virus. You can do that, or to make it easier, you can do the third panel of the third option on the bottom, which just says suspected category A infectious substances. That way you don't have to worry about misspelling an organism name. It means the same thing as the second bullet point. I think it's an easy recommendation to give to your laboratories if they're in this situation, to kind of utilize that third bullet point there for suspected category A infectious substances in place of the technical name of the organism. So the other part of this, in addition to just the packaging and the paperwork that comes with the box, is this slide here, and that's the judgment, right? So regarding judgment, assignment to this category A 2814 or 2900 has to be based on the known medical history and symptoms of the patient or source material, as well as the endemic local conditions and the other professional judgment concerning these individual circumstances of the source material, like travel history or exposure history. And then this middle point here, the infectious substances which do not appear on that example or indicative category A list, but still meet the criteria for being an organism that's able of causing this life-threatening disease. A good example that comes to mind is with coccidioides, right? So on the category A list, we only see Coccidioides immitis, which is a very dangerous fungal pathogen. So what this implies is that, let's say you knew that you had Coccidioides posidacei, which is an almost identical species to immitis. Like, let's say you had a test that really showed you that, but Coccidioides posidacei does not appear on the category A list. You are still expected to classify that Coccidioides posidacei as category A because it has the same traits as immitis. This is, I think, just a lag in updating the category A list based on current testing that's available. Because if you think about testing for Coccidioides, usually the test result says immitis/posidacei. So that's just kind of one example of where a shipper really needs to kind of take that into consideration. And then to kind of summarize here, if there's ever a doubt about whether your specimen should meet that criteria, the recommendation is that you just kind of go up and say, I'm just going to classify it as category A anyways, just to play it safe, because this is much safer packaging that provides protection for everybody along the way that's handling that. And then the professional judgment absolutely needs to be based on the professional judgment of the shipper. And sometimes, like we saw with monkeypox, CDC, WHO, and DOT are able to provide timely guidance on this to kind of clarify some of these more tricky organisms. Okay, so when an infectious substance is shipped, but it's unknown, this is where you're allowed to say, you know what, I'm suspecting that this PUI person could have an Ebola virus infection because they just traveled. So I'm saying, you know what, I am suspecting that the specimen that I'm shipping for an Ebola virus test really should be sent as category A. So this allows someone to say, I don't know yet, I haven't confirmed it, but I'm really suspecting that this specimen that I'm sending for this actual disease specific test should be sent as a suspected category A, right? So this is where we really see that professional judgment coming into the categorization of suspected category A. And then what's also really, really important here to note is that if you're choosing to use a suspected category A versus an actual category A, the box is still exactly the same, except for that technical name of the organism in the parentheses, which is only on the paperwork. They still are triple packaged the same way. It's still in a UN certified container. So everything else is exactly the same. It's just that one word on the paperwork. That's the kind of key difference here for how it's handled. Okay, so to summarize all the points here for suspected category A, the shippers are really the ones that have the primary responsibility here for making this kind of professional judgment. So if this is uncertain for some people, definitely reach out to partners inside your own facility, reach out to your local or state public health laboratory. These people have great advice to offer people. And then really kind of keeping in mind, what is the specimen source that you're dealing with? Is this a culture form or is this a primary patient specimen such as blood? And then also, like was already mentioned, really depending on all these factors related to the actual patient, right? So travel history, exposure history, and then what level of testing have you done already? And I think that wraps up for me, and I will hand it over to Karen. Thank you.
Yes, thank you, Rob. Excellent job there. I am going to just make a quick comment to what Rob said. Yes, when you are unsure and don't know what to do as far as packaging and shipping, and just safely saying, okay, let's ship it as a category A. However, you do have to remember you can't do this with all organisms. This is the more hazardous organisms or newly emerging. I would think if you're in a normal laboratory, you just cannot send all organisms as a category A, thinking it's the safest. because there's a lot of problematic situations with that as well. So we are truly trying to stick to our topic today. I'm going to go on and talk a little bit about some of the more fine points about the packaging itself, although I won't take the time to go through it all, obviously. We'll leave that for the long classes that we hold. So when it comes to deciding what box you're going to use, you would actually want to choose a box, as Rob said, that is UN certified. Well, what does that mean? Can I create my own box, kind of like I've done with category B? Well, yes, in theory, probably you could, but the catch is that you need to test each of your new configurations with all the same types of testing that that a UN certified package goes through. It goes through testing of shipping, shocks, temperature changes, pressure changes, and I've got a whole list that I'll show you. So you probably don't want to do this. I don't recommend it. And that's why manufacturers do all the hard work for us and provide these boxes for us. So if anybody has questions as to what manufacturers are available, we can provide those manufacturing. Not that we are saying one is better than the other. It's just if you need assistance, we can give you an entire list of manufacturers. So the whole important point is that the inner and outer packaging, they work together to form that certification. And therefore, if you change out one part of it, then literally you have nullified the certification. So think about it. If you have a round, hard plastic container on the inside, but you swap it out for a different company's little metal container, obviously all those tests that have been done are invalid. So it's very important that you use the category box as you have received it and use all the packaging that comes with it. So this is just a summary to say that category B does not require a UN certified box. In a pinch, we've been known to make our own category B boxes, and that you can intermix and match their prospective packages, elements. However, with category A, you cannot do that, and you must stick to the manufacturer system that they provide. So, just a note about training. I won't go through all that is required for training. Obviously, every year or every other year, especially if you ship FedEx, it needs to be 2 years. If you're only doing ground couriering, it can be 3 years. However, there's a lot of disciplines to training. Usually takes an 8-hour course for a brand new laboratorian to take all this information in. There are shorter classes for reclassification, so you can ask about those too. Now, the important point is that it is not the trainer who actually does the certification of that employee. In fact, just know that it is the employer of your facility who does that certification. So the employer is recommended to literally take the training as well. So much of the time, I think that training is handed on to the employee. Now, we know that as something new, DOT is requiring that the employers maintain competency in the program of packaging and shipping. That is fairly new and should be added to your list of competency testing done in your laboratory. So the manager does need to feel comfortable when they do the proficiency testing, when they watch the employee do the packaging from the beginning to the end. So obviously, category A is going to be that triple package, as Rob has always referred to. That primary and secondary is something that happens routinely in Ebola packaging right in the patient room. So think of it that way, that this is not your typical phlebotomy collection, that it is including a more rigid collection procedure. It's usually what we call partner method of collection. I believe Vicki Herrera spoke to that last week about it. But the reason for two staff members doing this procedure together is so that one, the person who draws, will follow the instructions, just like PPE. One reads the procedure, the person actually doing the PPE or the drawing of the specimen will follow step by step how to do it. It does slow the process down, but in reality, that's what we want. We want to make sure that the draw happens accurately. And the trained observer not only reads, but watches for mistakes. So that's why we are very picky about how the specimen is collected right there in the patient room. So ideally, it could be handed out to the clean side in the biohazard bag that is already disinfected and can be packaged right there. However, some laboratories might, within the facility, choose not to do it there, but take it up to their laboratory, again, in a triple packaged system, and repackage it for the correct packaging that needs to go into the commercial transport realm. All right. So here is an example of packaging, that triple packaging of what is considered primary. Obviously, the original specimen should be that original package, and then put into, if not one, possibly two, or even three secondary containers. Some of those secondary containers are considered use in packaging when it needs to be shipped by air. And that requires what we call KPA certified packaging, which can withhold pressure when it is truly in the air. Believe it or not, how do you know you have an appropriate box? How do you know it isn't just a made up box by somebody outside of the manufacturing line? Well, obviously it can be, a shipper can know what the box can do by simply looking at that UN specification or certification marking. And it looks like this. As you can see, it is specific to a number of things. What kind of box did they use? Is it cardboard? Is it wood? How rigid is that box? So in other words, this can tell the shipper a lot as to what kind of hazard level and physical characteristics of the substance can go into this particular box. So again, once assembled, it remains a single integrated unit. It is shipped this way and stored this way, and then emptied as such when it gets to the recipient. So this is what we call composite packaging, a term used by DOT. And again, here's all the different tests that go into making that box certified. And so it is not something that normally a laboratory can just at the last minute put together. Hence, all laboratories need to be prepared and have something available to them in an emergency. So with just a few minutes, it's important to remember that all the labels, including the addresses, be on the same side of the box. So many of the mail services people tell me all they look for is the certification, or not certification, excuse me, the address of the recipient so they know where to forward it to. And you need to make sure that they see the markings, the hazardous markings as well, so they know how to handle the box. Okay, so if you're using addresses, the addresses have to be complete with a name and a phone number of that contact person, as well as full street address, state, city, zip code, and such. You cannot skip these. You cannot just write the name of the public health lab on the box, even if it's ground, and expect it to get there, fulfilling all regulations. There must be a 24-hour contact listed on that as well. This particular person or persons must be available the entire time of the duration that package is in transit. They must be knowledgeable of what's being transported. They must know how to mitigate a situation if there's a spill to it. Some laboratories will use what are called third-party companies that they will contract with to serve as emergency contact. It's expensive, so they may not necessarily do that. They might just give them their laboratory phone number. And if that's the case, even the night shift needs to know all this information. So make sure that you work with them properly to be able to fulfill this emergency contact requirement. Differences between packaging ground versus packaging for something that's going to go via FedEx or USP or other air transport. Really, IATA is the stricter requirement. And so you know that anything that is packaged to fulfill the IATA requirements then will fulfill all DOT hazardous material requirements for ground as well. You need to know where this package is going to. If when I say reference laboratory, I mean public health lab. Typically for Ebola, do you remember that the commercial reference laboratories would not accept specimens? So this is know what reference laboratory, like your public health laboratory, you're sending it to, possibly even sending it to the CDC. So in summary, category B is usually shipped with all common couriers, including private couriers. But category A typically is only shipped with FedEx or UPS. They may be shipped with couriers that are what are considered private. It includes a lot of extra paperwork that is difficult to fill out. I'm going to go back and make a note with what time is remaining that private couriers, it is a very black hole. And I want to say that you must choose a reputable courier to make sure that everything's safely transported. All right. So we want to make sure that transporter or the courier or carrier is trained properly. So I tend to vet my couriers to see what kind of training they give the people who work for them. Want to make sure that they recognize hazardous material. They know what incident response is, and they know what to do in a time of spill or a time of leakage. All right. So vetting is a very hard process to do when you're choosing a courier. Usually there is a contract between a courier. You must make sure that that courier, especially when shipping category A, that they do not carry any other non-medical devices, that they do not eat in their car, they do not carry their pet, they do not carry other patients or their own children or another non-trained person with them. They must carry the appropriate insurance liability. They must, you must know, you must know if they're registered with DOT or not. And DOT will share with you if there's any existing violations. And they must know what to do if there is a spill. They must know how to clean it up, or more generally, they must know who to contact in order to clean up that spill. So just beware. Some couriers, like FedEx, will not accept potential risk group for pathogens, any pathogen that is confirmed. But yet, remember, our frontline hospitals are not yet categorized as a risk group 4. This is only suspected. So we still can ship category A with the appropriate couriers. All right. So any incident that a courier has or a carrier has, if there's a fire, if there's a breakage or suspected contamination, they will be reporting this to what is called the National Response Center within 12 hours even. So this is very important when it comes to category A, and do know that laboratories have to realize that the couriers will be doing this. All right. I do want to comment that if all else fails and there is no other means of shipping, there is one, can I say, loophole to the CFRs that does say that public health emergencies, law enforcement can be asked to possibly ship these specimens. The point is, though, if law enforcement is going to do this, that there has to be a plan ahead of time, possibly that law enforcement has an MOU with a public health lab or a frontline lab to do this for them.
So we had several questions that we wanted to go ahead and at least put out here. And I know that some of the questions that have come up have to do with guidance on, for instance, mobile teams who might not be dedicated to a single facility, questions about the categorization of some other pathogens like prion disease. And as Karen alluded to right at the end, are your options for these extreme situations where you may not have a trained person or category A boxes available to you when this happens to you. So Rob and Karen, if I can just get a couple quick answers to that, and then we're going to launch people off back into the world so they can continue. Please send questions if they have them to info@netec.org.
Yeah, thanks, Jill. I already responded back to one of the prion related questions, but to summarize Karen's last slide too, I think what's really important that's kind of not very clear here, but is an important message, is that everybody that's on this call today, we're assuming is working somehow in emergency preparedness. So, this idea about utilizing a law enforcement or a state, local, or federal official to be like a loophole to transport specimens, it's going to take people like that are on this call to take the initiative to bring that idea forward, right? Like someone has to hear that idea to even know, is this something that we can kind of put into consideration in our plan? So it's a possibility, and Nebraska's done a great job highlighting this, but like not everybody's doing it, even though it's an option. So don't be scared to initiate or propose an idea like that to your emergency preparedness partners.
Exactly. And to be honest with you, it took a lot of work to get the government, local state patrol to agree to that. So it's one of those things that you need to be talking beforehand, have full understanding, create videos and training for them that would assist them as well.
Thank you guys so much. I'm sorry that we don't have more time for questions today, but if you have additional questions, please send them to info@netec.org. We do have some subject matter experts, including Rob, Karen, and Vicki from our laboratory across the country who can help us answer those. If you need technical assistance on anything involving preparedness like this, please send a request at netec.org. All right. You can find us all over the web, on social media, and we hope that you'll join us for other educational information. All right. Thank you guys so much for your attendance. We appreciate everyone today. And Rob and Karen, thank you so much for all of that incredible information, keeping us on the straight and narrow when it comes to packaging and shipping Category A or suspected Category A specimens. Thank you guys so much. For NETEC, thank you all for attending, and we hope to see you soon.